So I am Allison Schaefer. I am on the marketing team here at the Maryland Proton Treatment Center, and today we are going to be talking about how proton therapy treats women's cancers differently. So our speakers today include Dr. Nichols. Her clinical research focuses on breast and gynecologic cancers, but she is experienced in treating patients with a wide variety of cancers. And her medical degree is from the University of Maryland School of Medicine, and her residency was also at the University of Maryland. And our other speaker today is Dr. Mohindra. He specializes in treating patients with gynecologic, thoracic, lung, and hematological cancers. His medical degree is from the University of Mumbai, and his residencies were at Tata Memorial Center in Mumbai, as well as at the University of Wisconsin. And he also had a fellowship at the University of Toronto. And our first speaker is Dr. Nichols, so I'm going to hand control over to her.
Thank you, Allison. So one of the things that patients always ask us are, why are protons potentially better than photon therapy? And so what this graph shows here are two different colors of how radiation can work in the body. So the blue is X-ray or X-ray or photon therapy, and the orange is proton therapy. And what you can see from the blue is that when X-rays enter the body, they enter the body at a certain dose, become a little bit stronger, and then as they pass through the body, they become weaker and weaker and weaker. Proton therapy enters the body at a low dose of radiation, becomes strong exactly where we want it in the tumor, and then essentially stop. And so X-rays do not stop, but proton therapy does. And so what happens is that this excess radiation over here on the right of this graph can be omitted when we potentially give proton therapy. And this can lead to some decreased side effects for certain cancers, as well as potentially decrease the risk of developing a cancer down the line from radiation therapy. So this here is a video showing how proton therapy can work. This is actually what our treatment rooms look like, and so you can see a fake patient here on a treatment table, and then the radiation machine moving around the patient. The technique of radiation that we have at our center is called pencil beam scanning or intensity modulated proton therapy. And we also have the ability to do what we call image guided radiation therapy, which for the last several years was not available for proton therapy. What you can see as we get a close-up picture here is that this is a patient who has a lung cancer, and the radiation therapy is going to be painted onto the tumor layer by layer. What you can see from this picture as while it's doing that is that the treatment itself generally takes about 5 minutes per day with the radiation actually being on. And patients come in daily for treatment, Monday through Friday, often for roughly 5 to 6 weeks, depending on the type of cancer that they have. We have the second center, the first on the East Coast, to be fully operational with this technique of radiation or pencil beam scanning, and this is available in every treatment room. So the vision for the Maryland Proton Treatment Center is to be a regional resource for our patients, not only here in Baltimore, but also in the Mid-Atlantic region, and to become a proton center of excellence across all academic missions, accessible as a regional resource to and in partnership with major regional health systems and oncology providers. And so we've actually partnered with other big systems, not only in the state of Maryland, but also in southern Pennsylvania, as well as northern Virginia for this. Our goal is to be accessible, affordable, and convenient. Additionally, at the Maryland Proton Treatment Center, because we are affiliated with the University of Maryland Marlene and Stuart Greenbaum Comprehensive Cancer Center, which is an NCI-designated comprehensive cancer center, our patients have access to several gynecologic oncologists, medical oncologists, surgical oncologists, and many other clinicians and providers that can serve your treatment needs so that the patient all of their oncologic needs can be met while getting treatment at the Maryland Proton Treatment Center. So specifically, when we talk about breast cancer patients, there are certain breast cancer patients that we think will benefit from proton therapy. So some of the examples for this are patients who have left-sided breast cancers. So the heart lies more on the left side of the chest than the right. So women with left-sided breast cancers are potentially more at risk for receiving radiation to the heart than women with right-sided cancers. And generally what we find is that proton therapy can dramatically reduce the radiation exposure to the heart and coronary vessels. This is very important because some studies have shown that the lower the dose of radiation therapy to the heart, the decreased risk of side effects to the heart, including heart attacks, heart disease, and heart failure down the line. We also think about proton therapy in women who have right-sided breast cancers who are receiving radiation to their lymph nodes, especially what we call the internal mammary lymph nodes, because even in these patients, the heart often does receive some radiation dose, and so proton therapy can decrease that significantly. We think about proton therapy in patients who've had prior chest radiation, and this can include for lung cancer, for lymphomas, or even other breast cancers in the past, either on that side or the other side. So patients who've previously received radiation from photon therapy are often good candidates for proton therapy because we can really decrease the amount of normal tissues that are exposed to treatment. And then the last scenario we commonly think about for breast cancer patients in particular are those patients who've had a disease recurrence, meaning their breast cancer has come back. So because proton therapy is very precise and helps us to avoid some doses to the normal tissues, we can often use proton therapy a second time and not only decrease long-term side effects, but also potentially give additional dose of radiation that we couldn't achieve with photon therapy. So here's just one picture example of a patient with a left-sided breast cancer. And so on the left here, you can see photon radiation therapy. On the right, you can see a proton radiation therapy plan. The red color here that you see is what we call the 100% dose of the radiation. And then the green color here is a much lower dose, a 10% dose of the radiation therapy. And what you can clearly see from the left picture to the right picture is that these lower doses of radiation therapy that I'm circling here are much decreased when we consider proton therapy. Additionally, these tiny gray circles here that you can see on both images actually represent the coronary heart vessels. And so what we can clearly see from the proton therapy plan is that those coronary vessels are receiving either no or a much smaller dose of radiation with proton therapy than we can see with photon therapy. And so again, we think that this can decrease the long-term effects on the heart in this type of patient. Here's just another example, and this is actually from a journal that showed a paper showing some different techniques of radiation therapy. And while this is very busy, what I want to focus on is that this picture actually shows some different slices of the patient. So the patient's actually cut up like a loaf of bread in these three pictures here. And we see going from the top closer to the head down to the bottom closer to the stomach. And we can see that this kind of low dose sparing of radiation therapy from any of these three techniques compared to the proton therapy, which is in the yellow box, is much decreased with proton therapy. So here where my cursor is right now, we can see a much lower dose to the other lung as well as the lung on that side. As we move to the right here, again, we see the heart coming into view. And so again, we can see that this whole portion of the heart is being spared. And as we come lower down here, this is one of the more important parts of the heart, or the left ventricle. And we can see that with all the different techniques, there's low dose going to that left ventricle, but in proton therapy, that's spared significantly. And this last picture here is just another slice where if we're cutting someone up from left to right, we can see in that view that, again, a lot of lung tissue is spared with proton therapy. So now I'm going to turn it over to Dr. Mahindra, and he'll be talking about proton therapy for gynecologic tumors.
Thank you, Dr. Nichols, for an excellent overview of the role of proton beam therapy in treatment of breast cancers. Much along the same lines, proton beam therapy can have significant benefits when treating ladies with gynecological cancer, because it can spare the tumor radiation dose to the surrounding healthy tissues and organs, which includes the bladder, the bowel, and the pelvic bone marrow in the area of the pelvis, and even in the area of abdomen when sometimes we have to give radiation to the lymph glands. We can reduce the radiation dose to the kidneys, abdominal viscera, and liver. As you see in this color diagram shown, picture on the left is using proton beam radiation therapy, wherein we are targeting the lymph glands in the center of the body with a radiation beam with protons coming from the back side. But by doing that, as you see, the kidneys on both sides are getting practically no radiation dose. The liver also is getting no radiation dose, and the surrounding bowels is effectively getting no dose. Whereas on the picture on the right side, again, these different colors representing different radiation doses. The high dose are the colors in red and oranges in the center, but there is a lot of low dose of radiation that spreads around to all the organs with conventional techniques, which we are able to minimize with protons. Another example, as we see here, this is a 46-year-old patient that we had treated with a recurrent form of an endometrial or a uterine cancer. Unfortunately, this cancer was not surgically removable, and hence we had recommended radiation treatment to the patient. Because of the location and her young age, we offered to treat her with proton beam therapy. And as we see in these color diagrams, again, picture on the left shows a proton beam plan where we are using two focused proton beams coming from one on either sides, focusing all the high dose shown in red and orange in the center where the tumor is, but basically allowing no dose going to the organs in the front of the pelvic area. This patient is lying on her belly, so that really no radiation goes to her large and small bowel, and we can also minimize radiation going to her side structures on the abdominal wall. Whereas if you look at the picture on the right side, when using the most advanced form of photon therapy, which we have available as well here at University of Maryland, it gives the really high dose to the tumor area, but there is a lot of radiation dose that goes all around the tumor, which can be minimized, especially for this young patient. Another example for another 45-year-old patient who was unfortunately diagnosed with a sarcoma of the vulva. It's a kind of cancer that arises in the soft tissues, and she had to undergo a major surgical procedure to remove the cancer. In addition, because of the risks for recurrence, she was recommended post-operative radiation therapy after meeting with our multidisciplinary team at the University of Maryland Greenebaum Comprehensive Cancer Center. Because of her young age and being mindful of not just short-term but long-term side effects, we offered to treat her with proton beam therapy. And as we see in these pictures, we used proton beams coming from the front direction, pointing all the radiation to the structures where the surgical area and the tumor used to reside. And by doing that, because of these abilities of the protons, effectively no dose is going to any of these abdominal structures, including her uterus, ovaries, small bowel, the femur bones, and the pelvic bone marrow. Again, this image on the right shows the same thing on a side view, when again we demonstrate all the radiation going in these colored lines to the areas of the surgery, but no radiation going to any of her deep pelvic organs, thereby minimizing her short-term and long-term side effects. Another example, and this is a very important indication or use for proton beam therapy. This is a young patient who unfortunately was diagnosed with cervical cancer, which is a cancer of the lower part of the uterus, and had undergone extensive course of radiation and chemotherapy nearly 2 years ago. Unfortunately, she had a cancer recurrence in one of the lymph glands in the pelvis, and hence we have offered her a course of re-irradiation or a second course of radiation to the same site. I would like to highlight that ordinarily we don't like doing radiation twice to the same part of the body. However, with use of modern technology such as proton beam therapy, we can try and minimize the risk of re-irradiation while achieving excellent tumor control options and getting a second chance to beating the cancer. So as we see on this color diagram, picture on the left shows standard X-ray or photon-based radiation that's focusing all the high dose of radiation to the target volume, but it is coming at the expense of a lot of radiation dose spread to all her pelvic organs. Whereas on the picture on the right side, by using just 2 proton beams, we are able to still get very high dose of radiation, higher than what we could have achieved with the standard X-rays, to the target area, but giving practically no dose of radiation to any of the abdominal or any of the pelvic organs. So re-irradiation is a very important use or indication for proton beam therapy. To summarize, for gynecological cancer patients, proton therapy has the potential to lead to fewer short and long-term side effects, particularly to the small bowel, large bowel, bladder, kidneys, and pelvic bone marrow. Proton therapy can be especially beneficial for patients with advanced endometrial and cervical cancer, those who have had prior radiation therapy and for whom a second course of radiation is recommended, and patients with disease recurrence where other options, including surgery, may or may not be available. Proton therapy is especially important for patients who are unfortunately diagnosed at a younger age, like our adolescents and young adults, wherein again, we are not just focused on the short-term side effects, but we want to do everything to prevent long-term side effects that may show up many decades from now. That's where proton beam therapy can have significant advantages. One other important aspect of getting treatments at the Maryland Proton Treatment Center is the availability of various clinical trials and research options. Maryland Proton Treatment Center is dedicated to advancing scientific knowledge about the role of proton therapy in the treatment of cancer. All patients treated at MPTC have access to a wide range of clinical trials that are available through the Maryland Proton Alliance and also based on our affiliation with the University of Maryland Greenebaum Comprehensive Cancer Center. Clinical trials provide the options of direct access to innovative therapies, often years before they may be in widespread use. Hence, faculty here at Maryland Proton Treatment Center who are associated with the University of Maryland School of Medicine encourage clinical trial participation for all patients when available. Each participant in a clinical trial is also doing a service to the larger battle against cancer and the advancement of medicine, and we appreciate our involvement of our patients in participating in the clinical trials. At this point, I will hand over the slides to Ms. Allison, who will provide additional overview specific of the Maryland Proton Treatment Center. Thank you for joining.
Thank you, Dr. Mahindra, and thank you, Dr. Nichols. So a few things to keep in mind when choosing the Maryland Proton Treatment Center. We are one of only 2 centers in the country to offer the latest technology, pencil beam scanning, in every room. There are less than 25 proton therapy centers in the country, and our physicians have an average of 18 years of clinical experience and a combined 20-plus years of proton therapy experience. And unlike other proton centers, we have established a cost-neutral rate for treatment, which means that the cost for proton therapy is equal to the cost of traditional radiation therapy. We also have a concierge team that provides a range of services free of charge to you and your family, and that includes free valet parking, help coordinating appointments, arranging lodging, transportation, or just adding a detail that will make you feel more comfortable. We focus on taking care of the logistics so that you can focus on treatment. And this is one of our patients and what she had to say about her experience here. She said, as soon as I met with Dr. Nichols and her staff, I felt comfortable here. Everyone at the center, from the valet drivers to the front desk staff, is warm and genuine. And that's from Rosemary Hess. And we have plenty of stories of patients like her if you visit our website at mdproton.com/meetourpatients. So if it sounds like proton therapy could be right for you, please give us a call at 410-369-5200 or visit us online at mdproton.com to request a consultation. At this point, I'd like to open it up for questions.
Hi, can you hear me?
Yes.
I'd like to ask a question. Would a person taking proton therapy, would you still be able to work during the treatment? Like, would you still be able to go back and forth to work every day?
Yeah, so I can help answer that. This is Dr. Nichols. Yeah, so the majority of our patients are actually able to work, and at least when it comes to, I'd say, breast cancer patients and many of our GYN patients, most people feel that they're able to work in their full capacity. One of the side effects of radiation can commonly be a little bit of tiredness, but for the majority of women that I've interacted with, that tends to be more towards the end of the day where they just feel like they run out of steam a little bit quicker. than they usually do, but during the day that they feel very good. And so patients are able to drive themselves to and from treatments. It's not something that you have to have someone else drive you for. The other thing I always like to mention is that we also give patients their entire schedule up front, so you can kind of know each day when you're coming for treatment. And for a lot of people who are continuing to work during therapy, that's important for the logistics of making sure they can still do what they need to do. And again, we're happy to support any of our patients who want to continue to work during their treatment.
Okay, thank you.
Okay, if there aren't any other questions, we'll close the webinar now, but please feel free to give us a call if you do have any further questions or visit us online. Thank you.